our stakeholders in? Great. Thank you very much. Welcome everyone to the Public Health and Minority Health Disparities Subcommittee. Thank you everyone for your patience and for getting here as quickly as possible. So, you know, as the session goes on, this is when we start encountering time crunches. We have 5 bills on the agenda today that we're going to be considering. Not all of them are completely worked out, but we're going to get an update on some and hopefully be able to move on some others. So I want to start because I have 2 members that are not part of the subcommittee, so they're in here on behalf of their bills. So I'm going to start with them. If we can go to House Bill 672. This is the School Health and Wellness Personnel Assessment and Maryland Council on Advancement of School-Based Health Centers. The subcommittee, you should have a reprint of the proposed amendments from the sponsor. And Aaron, if you can walk us through the bill and the amendments, and then we'll open it up for conversation. We'll hear from the bill sponsor.
The bill adds a school nurse member who's nominated by the Maryland Association of School Health Nurses to the Maryland Council on Advancement of School-Based Health Centers. The bill also requires MDH and MSDE to conduct an annual assessment of the school health and wellness personnel workforce in the state. And MDH and MSDE must jointly submit a report to the General Assembly on the findings of the assessment by December 1st, 2027, and annually thereafter. There is a reprint of the bill with amendments that are being offered by Delegate Cullison, who is the bill sponsor. And on the last page of the reprint, the amendments will require MDH and MSDE to publish their report findings on their websites, and also require MDH to consult with associations of school health and wellness professionals on strategies to improve the recruitment and retention of such personnel.
Thank you, Aaron. And let's go ahead and hear from the bill sponsor, and then I'll ask for a motion on these amendments. Vice Chair, if you could unmute.
You think I would know that by now. Thank you so much, Madam Chair, for giving me the opportunity to speak to this bill. The intent of the bill is to provide us with the information that we need in our school systems in order to make create informed strategies around how to hire the folks we need to best support our students in schools, to help them to have maximum attention and capacity for learning, as long as we can address some of the issues that they might be facing. And a couple of amendments, the first being, we feel like the information needs to be public because the public can be helpful in the searching of new recruits or recruiting, and helping to provide information and perhaps innovative solutions to finding the staff that we need. So that's one, and I appreciate that the Horizon submitted a couple of amendments, one of which we think is going to be taken care of by the stakeholders, but and we also want to say that the data should be analyzed along all lines. We're going to look at geographic areas. We're going to look at, the diversity of the workforce. We're going to look at all of the factors that are maybe barriers to hiring the staff that we need. And so I think the amendments sort of address some of that. And one amendment that was recommended was to include community providers in the data gathering. While I think that's important, I'm afraid that would be an additional burden on both agencies and increase the need for greater staffing. So I would ask that we not include that at this point, knowing that as the data gathering becomes more facile, we'll be able to consider that in the future. So with that, Madam Chair, I will leave it to your committee to move forward and hopefully give it a favorable report. Thank you.
Thank you, Madam Vice Chair. Do I have a motion on these amendments?
Move the amendments.
Second.
All right, they've been moved and seconded. Do we have additional questions, concerns? Delegate Hill.
Thank you. And Madam Chair, Madam Vice Chair and sponsor of the bill, couple quick questions. You mentioned the Horizon amendments. Do your amendments take into account the Maryland Schools Psychological Association amendments? Is the first question, and if not, were those just amendments that you did not find appropriate?
If I may, Madam Chair. We did take it into consideration and we addressed that issue by saying that the departments had to consult with the Association of School Health and Wellness Professionals. So not limited to psychologists, but branched out to the other areas of the professionals being covered.
Great. And then the second
you.
question from my hearing notes, there was the fiscal note issue, and I had a question about, do you know if the pen is an unfilled pen, or they have filled all their folks and they're all being used, as much as they can be, and they really still need a new halftime person?
I'm sorry, I was not able to follow up on that, so I don't have that information.
All right. So the fiscal note is still what it is?
Yes.
Okay. Thank you.
Thank you,
Thank
Delegate Hill. And obviously we will have to address the fiscal note because these amendments do not address that. And it looks like that was a request from MSDE, so we can follow up with the Department of Education. Delegate Chisholm, your hand went down. Did your question get asked?
One of those miraculous days when Terry Hill asked my question.
Oh, fantastic. All right. Well, the amendments have been moved and seconded. So all in favor, say aye.
Aye.
Anyone opposed, go ahead and raise your hand. Delegate Chisholm,
Are we on the amendment?
we're on the amendment.
Okay.
So the amendments passed unanimously. Do I have a motion on the bill?
Move the bill.
Second.
All right, it's been moved and seconded. Do we have further discussion on the bill as amended? Anyone who wants to be heard? Anyone who feels they weren't heard? All right, Delegate Riley.
Thank you, Madam Chair. I actually really do like the intent of this bill. But at this point with the blueprint, which is one of the items that we're really talking about right now, and I have pretty good knowledge of this. I've had a bill for the last, 6 years. It's passed, it had a study, we know what's wrong, and it deals with school psychologists. And it seems like it keeps hitting a bump in the road because there's people that say, well, no, it's gonna hurt the blueprint. We're, concentrating on teachers, blah, blah, so on and so forth. And, and then they talk about, well, why aren't we putting the counselor, which we need social workers, we need counselors. We have that data. My bill has a lot of data and we've received information from school superintendents. The data is already there, but we don't seem to move it because of the big bill in the room is the blueprint. And now we add the deficit to that, our budget deficit. I know that you tried to take care of the the fiscal note in this, which was pretty low. I agree, pretty low. But I think we get all this back. And all of this is really, besides the social workers and the school psychologists, school social workers, all of those, I think, are definitely part of our school system. But now we're pulling in all of these other items. And I get it because it's for, the school health and wellness program. But I just don't think it's the time to do all of this right now. And I think we probably, if you look at other resources, we have the data. Like I said, with the school psychologist, I can prove it to you. It's just that as a whole, I see we're spending this money and spending all this time and nothing's going to happen. And it's very frustrating to me to see this year after year. And I don't know if because my bill doesn't go through HGO and, we understand the seriousness of school psychologists and social workers and counselors. School psychologists are the only ones that can deal with the IEPs. Half of our students have IEPs. But it just blows my mind, and I just have a hard time, voting for this one at this point in time when I'm afraid it's going to be, nothing's going to happen. And it's very frustrating. So there you go.
Thank you, Delegate Riley. And I appreciate that. And I will say, I share your frustration. And I think this is looking to solve that issue of having the right expertise working on this issue. Delegate, Vice Chair Cullison, did you want to respond as the sponsor?
Madam Chair, you basically said what I was going to say, but first of all, Delegate Riley, thank you very much for raising that because it is a concern. But what this bill does is makes two agencies responsible for this data and then responsible for doing something with it. So, with respect to the blueprint, I think this addresses the mental health parts of the blueprint really well. The other professionals are all about, ability to, whether it's physical or emotional abilities to be able to learn for students. So I think the reason this bill is before HGO is because we've brought the health department into the mix here to be jointly responsible and accountable for results. So, but I appreciate your remarks, Delegate.
Thank you, Madam Vice Chair. And I will just say before we call the vote, I appreciate both of your remarks. As some of you know, I had a bill in to create a commission to get these agencies to work together, and I share Delegate Riley's frustration because that too did not pass because we didn't have the expertise. So I appreciate that I think this is getting us to where we've been trying to get. For many, many years. And with that, we do have a motion and a second. So all in favor of House Bill 672 as amended, say aye.
Aye.
Anyone opposed, go ahead and raise your hand for the record. I have Delegate Chisholm, did you have a question or are you opposed?
I'm opposed to the bill.
Okay, I have Delegate Chisholm, I have Delegate Riley. All right, the House Bill 672 passes not unanimously. Thank you very much, everyone, for the discussion. This is very, very important. We are going to unmute so that I can tell you that we are, Delegate Riley, did you have further comment? No, just from before. Okay, perfect. We are going to move now to House Bill 334, Universal Newborn Nurse Home Visiting Services Program Establishment and Insurance Coverage. I think we're getting an update on this bill, but as we do have, once again, the bill sponsor here, this is Chair of Subcommittee Day. So I want to make sure that we're giving Chair Kerr an opportunity to speak to the work that has been done. Aaron, if you could fill us in on the bill and the shared work group language that was shared with the subcommittee, and then I'll turn to the bill sponsor.
So I sent you an email with this work group language about an hour ago. So if you haven't checked, this was not provided in the original email with the other amendments. Last week, this bill was in subcommittee. There was discussion on kind of narrowing or kind of getting a better sense of the purpose of the work group. So before you is another attempt at language. It would create a work group on newborn home visiting services in the state. As for the membership, it would include a member of the Senate, a member of the House of Delegates, the Secretary of Health or their designee, a representative of the Maryland Hospital Association, a representative from each certified site in Maryland implementing an evidence-based universal nurse home visiting model for families with newborns, one representative from an organization in the state implementing at least 2 approved maternal, infant, and early childhood home visiting models, a member representing private insurance carriers, a representative of the Maryland Nurses Association, a representative from Be More for Healthy Babies Initiative, and a representative from a local health department. The purpose of the work group would be to compile updated participant data and expenditures per participant from the home visiting for families with newborns programs that are currently operating in the state, to compare the data for home visiting for families with newborns in the state to the evidence-based models for universal nurse home visiting for families with newborns, and then to identify service gaps between the evidence-based models with the current programs, to identify opportunities to align the evidence-based models for universal nurse home visiting families with newborns with the current home visiting programs operating in the state, and to identify potential funding sources to close those gaps. The work group would also identify workforce needs, for the evidence-based models for universal newborn home visiting with families with newborns, and recommendations to fill the workforce needs. The work group would report its findings to the General Assembly on or before December 31st, 2025. And also there is an outstanding staffing issue. The bill as passed by the Senate would have MDH staff. MDH is not interested in staffing. Some advocates have been looking out to some private entities. I know the Maryland Family Network has offered to staff. There's also some discussions with Johns Hopkins, perhaps providing a research assistant to provide staffing. If a bill passes, you cannot require a private entity to provide staff. You can say the entity may provide staff. The General Assembly, as a rule, doesn't like to do that, or we are advised as legislative services not to advise you to do that because you have no guarantee of staffing. And if you do authorize a private entity to staff, we like to, you would say something like MDH in conjunction with that private entity. So you would want MDH to be on board to be staff if the in the event there's a the private entity does not staff the work group.
Thank you very much, Erin. And just as a reminder to the body, this bill did pass the Senate, but in our previous work session, there were some concerns raised about the modalities, and so I want to thank Delegate Hill and Delegate White Holland for working with the bill sponsor in crafting some of this language to get closer to the intent. And with that, I will ask the bill sponsor to update us on where we are and what you need from us.
Thank you, Madam Chair. Actually, Erin did a really great job of bringing everybody up to date. I don't have anything to add except to thank her for working with the advocates to get us to this point. I think we just need a bit more time to work out that the staffing issue. Other than that, I think that we should have something for you next week to be able to move this bill forward.
The amendment.
Thank you.
Thank you. Oh, Delegate Hill, did you just move the amendment?
So that we could have the conversation, move the amendment.
Second.
All right, it's been moved and seconded. We can go ahead and have the conversation. I wasn't going to try and move this bill today because we still had things to work out, but let's go ahead and have the discussion on this amendment, knowing that we still have a bit of work to do, so we probably won't move the bill today. But go ahead, Delegate Hill. Oh, you just unmuted. Are you just muted again?
Okay. I'm going to try now. Thank you, Madam Chair and Delegate Kerr. And this is Evangeline. She's shadowing me today. Unfortunately, I was not able to meet with Delegate Kerr at the time, but I like what's happening. I just would add for consideration, there should be a pediatrician on this work group. And I met with some folks yesterday from Community Coalition of healthcare groups who are very excited, very interested in working aggressively with you on this bill, interested in doing anything they can to support that I will give you information about. But yeah, so, and I don't know whether a GYN should be on it too, but I suspect so because we're looking at the mother and the child. So I'd like to suggest you consider that. And this would change the fiscal note which was one of the issues, right? Okay, thank you.
That is correct. Thank you, Delegate Hill. Is there anyone else, while we're working on this, that would like to be heard on this bill? Robin Elliott.
Good morning, and thank you, Delegate Hill, for your remarks. I've been talking to a number of colleagues who are very interested and I think could help really not only add to the discussion of what the program should look like, but also add to how it's integrated into our healthcare system. And with that, I wanted to lift up nurse midwives as being a really wonderful resource, as well as our federally qualified health centers, which of course would be doing coordinating with any programs implemented. So, and just to let you know, the physician assistants were super excited about this bill. So I want to be sure to mention that they were interested as well. So as you are thinking about this bill next week, just wanted to make sure that you have that information.
Thank you very much. Thank you very much, Robin. Procedurally, because I think we're going to amend this amendment, can I ask for a motion to withdraw so that we don't have to vote it, so we can continue to work on it?
Motion to withdraw the amendment.
Second.
All right, perfect.
Okay.
All in favor of withdrawing?
Aye.
Aye.
Perfect. So that'll give us a little more time to work it out, but it sounds like we are on a good path. And so once again, I want to thank all the stakeholders, and especially our sponsor, Delegate Kerr, and Delegate White-Holland and Delegate Hill, who have all been working diligently to try and get us there. So thank you very much for the update. We're going to go ahead and move on to our next bill. And this is House Bill 728, Opioid Restitution Fund, Authorized Uses. This was, again, we had a robust hearing on this bill. This bill would allow the Office of the Attorney General to report on opioid enforcement office activity to the General Assembly. Sorry, that's I'm talking about the reprint, which was the amendments that were being offered. This was the bill that would allow some of the opioid restitution funding to be utilized in support of the opioid enforcement office. With that, I will turn it over to Aaron to explain the bill and the amendments, and then I'm going to ask for a motion.
The bill would alter the authorized uses of the opioid restitution fund to include providing funds for operating expenses and personnel costs for investigations, enforcement actions, and other activities of the Opioids Enforcement Unit of the Office of the Attorney General that are related to the recovery of funds from opioid-related judgments or settlements. There was a reprint that was provided that incorporates amendments that are being offered by Delegate Rosenberg, who is the bill sponsor. And these amendments are on the last page of the reprint, provide that would require the Office of the Attorney General to report on the activities of the Opioids Enforcement Office to the General Assembly for the next 4 years each year. And it also would sunset the entire bill in 4 years.
Thank you, Aaron. And I just got a message from Delegate Rosenberg's office that he's having some technical issues. So I'm just going to hold this discussion since he is the bill sponsor and is also the amendment sponsor, so that he can get on this call. Because apparently they're not able to hear the conversation.
He's on.
Oh, Delegate Rosenberg, are you able to hear us now? Go ahead and unmute.
Yes.
Excellent. Okay, we are on your bill and on your amendments. We were just starting the discussion. So if I could have a motion on the amendments.
Move the amendments.
Second.
All right, they've been moved and seconded. All right, let's go ahead and have anyone have questions on the amendments? Questions, concerns? Delegate Chisholm.
I'm trying to read the amendment real quick. So it's the new language in here says personal costs for investigation. is that the big change in this amendment? The number of investigations taking place, how are we paying the AG's office now for these type of investigations? Where's that money coming out of the general fund, or is it taken directly out of the actual opioid restitution funds we're getting as a state?
Can I answer that question, Madam
Sure.
Chair? The
Yes.
people in the opioid restitution fund enforcement areas, about 6 or 7 of them, and they are being funded out of the consumer protection fund, which is dwindling down. And so in about 3 years, we won't have any money in that fund to support the consumer protection division or the opioid restitution fund.
In a regular legal case, the law firm that brings the case and wins gets a percentage of whatever the funds are. That's never been the case with the restitution fund. Am I to understand that?
No, it has not been.
And what are we looking at? How much are we looking at if we pass this bill? How much would then be diverted over to the Attorney General's office and not back out into the communities?
1.5 million.
Per year?
Yes.
How many?
That's why it has the 4-year sunset. So we see how it works out.
Okay, so it's money we were getting in.
I don't hear anything
regardless,
again.
correct?
I'm sorry.
That was money that this money we're getting in regardless. What we're
Yes.
saying is
I'm
we
lost.
want to take $1.5 million of the money we're getting in and not send it out where it's originally intended, but we just want to make sure that we fund the Attorney General's office with it.
Well, it's actually funding the unit that's doing the lawsuits, that's bringing the money into the state.
How
So
many?
it's not that.
But
If
I'm
we
sorry.
don't get money to fund the unit, then we won't be doing any cases.
And Ms. Harris, just for clarity of the body, can you remind us what percentage this amounts to of the current settlements, and whether we think that there are future settlements that will result from this continued work?
Yes, there's a lot of other bad actors we can go after. Pharmacies, people that are over prescribing opioids still and filling orders for opioids. So there's a lot of people we can still go after, minus the pharmaceutical companies. And it's a very small percentage of what's come into the state already. Because I think it's somewhere a little over $200 million has come into the state. There's promised, I think, 600 and so million.
Right. So so all the pharmaceuticals are now out of their settlement is done, correct? So the Purdue Pharma, all of them are done. So there's other actors you want to go after. How
Yes.
many people are in the unit that actually conduct all of these legal, I guess, suits?
7.
7?
Not all attorneys. Some are investigators.
Sure. Okay. Thank you, Madam Chair.
Thank you, Delegate Chisholm. Delegate Hill.
Thank you. I just wanted to clarify with Ms. Harris and follow up of Delegate Chisholm's question, that it's not simply that the settlements are there and we're pursuing other bad actors. It is also the job of this unit to make sure that the settlements that have been agreed to are actually paid and collected. So there's a sort of not quite enforcement, but there is a need to make sure that we finish the work that's already been agreed to. And without that, the money may or may not come in, but we'd have to move other resources from the AG's office to do that. And that means they can't do what they're supposed to be doing. Is that correct?
Yes, ma'am. You are correct.
Thank you very much, Delegate Hill. I see no other questions. We are on the amendments, correct? All right, so the amendments have been moved and seconded. We've had the discussion. All in favor of the amendment, say aye.
Aye.
Right. Anyone opposed to the amendments? Go ahead and raise your hand. All right, do I have a motion on
Move
the
the bill
bill?
as amended.
Do I have a second?
Second.
All right, it's been moved and seconded. Any further discussion on the bill as amended? All in favor, say aye.
Aye.
Anyone opposed, go ahead and raise your hand. All right, I have Delegate Riley. Delegate Chisholm. And Delegate Hutchinson, I see you waving your hand. Have I recorded you accurately thus far? Because I just realized. Okay.
Yes.
Perfect. All right. Thank you so much. All right. So Delegate Riley, Delegate Chisholm, Delegate Hutchinson. The bill passes not unanimously. Thank you. All right, we're cranking along. Thank you so much, everyone. House Bill 722. This is the Maryland Department of Health report on oversight of substance use disorder treatment programs and recovery residences. As you will recall, we had a rather egregious report on one of our facilities, and so this is a bill that Delegate Rosenberg brought forth. Erin, if you can walk us through the bill. I don't believe we have amendments on this bill.
Yes, there are no amendments, correct. This bill would require MDH on or before December 1st, 2025 and December 1st, 2026 to report to Senate Finance, Senate Budget and Tax, the House Health and Government Operations Committee, and the House Appropriations Committee on the revision of COMAR 1063 and improvements to the oversight of substance use disorder treatment programs and improvements to procedures for the certification, monitoring, and oversight of recovery residences. The reports must include an analysis of how the revisions to COMAR 1063 and other changes undertaken by the department will prevent events similar to those that occurred and were reported related to PHA healthcare, including patient relapse and death while enrolled in a substance use disorder program and housed in provider-owned buildings.
Thank you very much, Erin. And just for context, we had looked at the possibility of utilizing this to also have the department establish a rating system, but given our fiscal challenges, we believe that it would not be prudent at this time. So we are not amending that into the bill, but making the request with the department to start that work independent of this legislation. With that, do I have a motion on the bill?
Move the bill.
Second.
All right, it's been moved and seconded. Any further discussion on House Bill 722? All right, all in favor say aye. Anyone opposed? Go ahead and raise your hand. I'll give you a moment. Thank you very much. House Bill 722 passes unanimously. We have one more bill on our agenda. This is House Bill 553, the Maryland Medical Assistance Program Self-Measured Blood Pressure Monitoring. We do have an amendment. So Erin, if you can talk us through the bill and the proposed amendment. And I believe that this is the amendment as it passed out of finance. Is that correct?
Correct. The reprint before you reflects what was passed by the Senate Finance Committee. The bill requires Medicaid beginning January 1st, 2026 to provide coverage for self-measured blood pressure monitoring to recipients who are pregnant, are postpartum, or have been diagnosed with chronic kidney disease, diabetes, heart disease, or a cardiometabolic disease. Coverage must include the provision of validated home blood pressure monitors and reimbursement of healthcare provider and other staff time. The amendments that are before you would require that the amendments before you strike the specified definition of a healthcare provider, and they also strike the requirement for MDH to develop an educational campaign and report on the provision of these services to eligible program recipients.
And correct me if I'm wrong, these amendments also would eliminate any potential fiscal impact.
Yes, correct.
All right, thank you very much. Do I have a motion on the amendments?
Move the amendments.
Second.
All right, let's go ahead and open it up to discussion. We have the sponsor here.
And my shadow.
And your shadow.
Holiday.
Delegate Riley, I see your hand.
Thank you, Madam Chair. Last year we had one of these bills. What is the difference of this one? Did we expand what we passed last year, or did it not pass both houses last year? What's the difference? So we had a blood pressure monitor bill last year.
Yeah, it did
Is-
pass. My understanding is that this would just codify the specifics of the requirement that's being implemented by MDH.
Okay, so kind of like a technical that we failed to fix last year or what have you. Okay.
Yeah,
Thank
I
you
mean,
very
I think it just, last year you passed the general requirement and this year you're putting into law how it is to be implemented.
Oh, okay. Thank you so much. I appreciate that. Thank you, Erin.
It's the belt and suspenders. Delegate Chisholm.
Yes, thank you, Madam Chair. So if I understand the amendment, it's going to be paid through whatever eligible programs we have now, correct?
It's a
So,
special fund.
It's a Medicaid entitlement. It would be paid through Medicaid.
so it's an expansion of Medicaid then?
Well, last year would have been the expansion, and this year would be paying for the specifics of how it is provided. But according to the fiscal note, there's no fiscal impact because it's basically what they're already doing.
So they're kind of why I asked about the existing program. So it's already being done. So this is just codifying it, is what you're telling me?
Sending forth how it
That's
is to be
exactly right.
implemented.
Okay, thank you.
All right, we have a motion on the amendments. Any further discussion on the amendment? All in favor say aye.
Aye.
Anyone opposed to the amendment, go ahead and raise your hand. Seeing none, do I have a motion on the bill as amended?
Move the bill as amended.
Second.
All right, it's been moved and seconded. Any further discussion on the bill as amended? All in favor say aye.
Aye.
Anyone opposed, go ahead and raise your hand. All right, House Bill 553 passes unanimously. Before we go, I did just want to give Delegate Hutchinson an opportunity to speak to us a little bit about where we are with PFAS. I know Delegate Hutchinson and Delegate Hill, once again, are our heroes who have been working diligently with stakeholders to try and get us a bill. We're not there yet, so we don't have amendments to consider. So I just wanted to ask if you could offer an update, because I think we are going to be considering the bill in next week's public health subcommittee.
Sounds good. Thank you, Madam Chair. Obviously, an important bill as it affects our largest industry in the state, and for me on the shore, my largest, which is the poultry farming business. So we had Delegate Hill and I met with the bill sponsor and the opponents right after the hearing. When we had that, we had a good discussion, but still, still apart in terms of a compromise. I do understand, and I'm expecting today that we will have a proposed compromise, I think, by the end of the day for us to consider, and that will focus around the definition of PFAS, perhaps extending the deadline for the dates of the current bill and a few other issues. But that's all I have to report right now, that we are working on a compromise, and hopefully we'll have that's finalized by the time we come back to committee here.
Thank you very much. And I have a hand from Delegate Hill.
Yeah, I just wanted to add, we did ask the industry, the opposition, to also give us a list of, so there are about, 66 chemicals. We're talking about the difference between the two definitions. And we asked them if they could even give us a sense of if there are certain PFAS single carbon, which is the one definition. So it's the one carbon versus two carbon. We asked them to look at that list and tell us which are the ones that they think would really affect them if they couldn't have access to them. And hopefully they'll be getting that back to us as well.
Thank you very much, Delegate Hill, and thank you both for your diligent work on this. I just want to say thank you again to the subcommittee. I definitely have my favorites. And I'm not saying that we're the best subcommittee, but I'm not saying it either. So thank you all very much. With that, we have completed our work for the day. we have bill hearings at 1 o'clock, so please go and get some lunch. And with that, can I have a motion to adjourn?
So moved.
Second.
All right, we've been moved and seconded. We are adjourned. Thank you all for your hard work.